Minister, my question to you this afternoon is to ask you, when the protocols regarding methadone treatment were last reviewed, and specifically, are you satisfied with the progression pathways that are available? Are they sufficient to ensure that people who want to progress from methadone programme to become drug-free can do so?
Thanks, Chair. And thanks to Deputy. Methadone prescribing from opiate dependency is a key element of harm reduction approach to opiate use and set out in our national drug strategy. Methadone is one of the medications used in opiate substitution treatment along with Suboxone. As of the 30th of November 2018, over 10,000 people were in receipt of methadone maintenance treatment. The HSE provides an opiate substitution treatment in a number of treatment settings to meet the needs of individual drug users, including primary care, treatment centres and residential facilities. Since 2016, an additional 350 treatment episodes have been provided in Tier 4 residential centres at a cost of £2.15 million. Within the last year, the HSE has established services in South Tipperary, Wexford, Limerick and a service in the Midlands, which was due to open, I believe, has now opened in September already. A review of the methadone treatment protocol was published in December 2010. Arising from the review, the HSE implemented an opiate treatment protocol so as to provide appropriate and timely substance treatment and rehabilitation service tailored to individuals' needs. In 2016, the HSE published the clinical guidelines for opiate substance treatment. The guidelines are the first for the specifically related to opiate substitution treatment in the HSE clinical and primary care setting. Opiate substitution treatment supports patients to recover from drug dependency. The HSE Addiction Services work within the National Drug Rehabilitation Framework to support progression pathways. The framework ensures that individuals affected by drug misuse are offered a range of integrated options tailored to meet their needs and to create rehabilitation pathways. I believe that the methadone treatment reflects the public health approach to the drug and alcohol misuse set out in our national drug strategy. Moreover, it is an important tool to reduce harm and to aid people to recover from drug use. I am committed to improving the availability of this treatment and to develop services to meet the needs of people with opiate substance misuse treatment.
Thank you for your reply, Minister. And first of all, I want to put on the record of the House that I recognise that methadone has a significant role to play in terms of harm reduction, whether it's in terms of a person's health or criminal activity and so forth. So there's no dispute with that. But my concern and the purpose of the question is, as you indicated, there are over 10,000 people who are currently on a methadone treatment programme. Over 6,000 of them are on it for 5 years or more, and over 4,000 are on the methadone treatment programme for 10 years or more. And I suppose I just also want to comment to say that since 2016, 70 or 80 teenagers have gone onto a methadone treatment programme. My concern is that some people seem to be on a programme and remain there for a very, very long time, and that there must be better outcomes. You mentioned that there was a review in 2010, and I think, you know, that in 2009, it is time that we review it again, knowing that people are on this programme indefinitely. And are we suggesting to somebody who goes onto a programme as a teenager at 17 or 18 or 19 that in 10 or 15 years' time they're still going to be on methadone treatment? There has to be a better outcome, and the figures are indicating that people are on it way too long, or some people are on it way too long.
Yeah, and I do agree with Deputy in raising the issue here, and looking at how we can proceed, looking at another programme again to identify the time people are on methadone. However, as the Deputy has already said, and I do agree with him, that people are on methadone over a long period of time. Some of those people have been on it over 10 years and longer, and for many of them it is an opportunity for them to keep stable and to continue to, I suppose, continue out their life and work as well at the same time, of many who I know myself. There is limitations, however, around the opportunities for GPs in areas regarding methadone services, and we do have a number of doctors available for GP1 and GP2s, and as you all know, there are problems in recruiting doctors into the GP2 services for level 2 methadone treatment, but we are succeeding around the country, and with the funding that has been made available through the HSE into the services in primary care and community care, I do believe there will be an outcome into the future. And also regarding the use of Suboxone now, which we have established in this country. However, there are 80 people on Suboxone, and 0.75 million was given in 17 and in 18, which gives us now a sum of 1.5 million for the year cost. And we all know, and the Deputy knows as well, Suboxone is a new initiative in this country. It's been brought in to help those people. Some people will never be on Suboxone. It isn't. They're not able for that treatment, but however some will be, and we will continue to roll out the Suboxone treatment. But I do agree with the Deputy that it has been a number of years since 2001 in Wales, since the review was done, and we may need to look at it again. But I do believe there are people out there who on a daily basis are surviving and living out their lives and going to work and rearing families on methadone, and I think we can't forget the fact that that's there as well.
Minister, I'm not suggesting that one size fits all, but I am very concerned that over 4,000 people are on a methadone programme for over 10 years. And my view is that when somebody goes on the programme, that there needs to be personal plans to give them the opportunity for those who are suited to it to progress beyond a life on methadone. And for some of those people, it is a life on methadone. You mentioned about Suboxone, and I welcome your comments there. However, we're a bit of an outlier in comparison to most of the European countries. Most European countries would have 20 or 30% of those on OST treatment on Suboxone. We have a very, very small cohort that isn't the same as in Europe. And Suboxone, you know, there are a lot of benefits to it. It's less addictive, it's easier to withdraw from, less chances of overdosing and so forth. And I think the rollout of it in this country for people that could be suited and could benefit has been very, very slow. And one final point I just want to make, and it's an important point, Minister, you know, because oftentimes we talk about the risks taking somebody off methadone. There are risks for people who remain on methadone also. The drug-related death index, there are about 700 drug-related deaths per annum. Half of those are from poisonings. And of those who are poisoned, about a quarter of them are in receipt of methadone. That's 1% of the top population that are receiving methadone treatment per annum are dying. And I just make the point that I personally think we need to review it, and we need to review it with looking at personal progression plans and the alternative Suboxone being more widely available. Thank you. Sorry, Cahir, look.
Okay. Yeah. Okay. But just again and again in listening to the Deputy Curran as well, and I do agree, there is a small percentage of people on Suboxone, but we are heading in the right direction, and we've had extra funding this year to pursue and to roll it out more, and we will do that over them. But under the new strategy, it's very clear to me and clear to my department that we will have to evaluate some of the methadone treatment numbers and see what we can do into the future with helping people to reduce. But we need more GPs to really come on board as well, particularly in GP2 services, to be able to help, particularly with chronic people coming into clinics, because that's the first port of call for them as well. But I do believe that we are, I suppose, approaching it in the right way. We might differ on how quickly we can get through it, but I would agree that there needs to be a review. It's been a long time, 2010, since the methadone treatment services have been reviewed. But can I just add, there are a lot of really good services out there in the community, and pharmacies and GPs, and they really have made a huge difference to people's lives. So I know we're not knocking it, but I don't think we should constantly be on the target of those people who are making a huge recovery through their lives because they've been on methadone, even for a short time.